guys can sit. Good morning. If there's anybody out there looking for seats, we have an entire row. And I didn't miscount, it's because people aren't here. So if there's anybody still outside looking for seats to come in, there's an entire row out here. So good morning. There we go. Welcome to Bristol Community College Health Sciences and Nursing Pinning and Recognition Ceremony. My name is Dr. Dorothy Chase. I'm the Dean of Health Sciences and Nursing, and I'll be your host for this morning's celebrations. I'd like to thank all of you for coming to celebrate the accomplishments of the students in all of our programs. We're here to recognize the students who have worked to create and engage in a vision for healthcare and their future, where Bristol was part of that journey. Before we begin, there's a few housekeeping items. In an emergency, please note where the exits are. They're in the back of the auditorium, and they're behind us, behind the stage. Please take a moment to silence your cell phones. Please try to remain in your seats and keep the aisles free throughout the ceremony. At the conclusion of the ceremony, we're going to have the stage, the faculty on the stage, recess out into the lobby, followed by the students, so that the students will have an opportunity, if they'd like, to see the faculty before leaving for their own personal celebrations today. Today we gather to celebrate a truly extraordinary milestone. It is the 60th anniversary of this remarkable school and one of our healthcare programs that began when the school opened. The nursing program started 60 years ago, 60 years of vision, dedication, and impact to our community. It's marked as the Diamond Anniversary. This celebration reflects not only longevity, but the strength and brilliance of what has been built and sustained over decades. Our additional programs followed suit. Dental hygiene celebrates its 60th anniversary in just a few short years, 4 to be exact. Continuing excellence and student success is always the goal, and to meet the needs of our community. Like a diamond, the nursing program has proven its resilience. It's adapted, evolved, and continued to serve its purpose with clarity and integrity in the community, as has Bristol Community College. We have continued to grow and meet the needs around us, adding programs to meet demands. Its legacy shines in the lives it has touched, the challenges it has overcome, and the community it has helped to shape. This anniversary is more than a marker of time. It's a celebration of the people whose hard work and belief in its mission have carried forward. To all the leaders, staff, volunteers, and supporters, past and present, thank you for keeping this vision alive and brilliant. Here's to 60 years of meaningful work and to a future that is just as strong and bright. Every student in these first few rows has accomplished something monumental to be proud of. All healthcare programs are both a challenge and an honor to be accepted in and successfully complete. The pinning ceremony symbolizes a student's hard work and dedication to their course and clinical work. Pinning itself marks a transition from student to practitioner. Each of you has completed your coursework and are competent to provide healthcare to our communities and society. As we pin each of you, this is considered your official welcome into your profession, completion of your educational requirements, and your transition into your profession. Behind me on stage includes members of the administration, including Ms. Joan Medeiros, the chair of the Board of Trustees for the college, the body that authorizes the granting of the degrees, Dr. Cedric Harris, the president of Bristol Community College, Dr. Andrew Fisher, the Vice President of Academic Affairs, as well as the faculty who helped shape your educational programs. Many of our faculty began a certificate or an associate's degree program, and many sat in the same seats and are proud Bristol graduates. I would like the faculty that are Bristol graduates to take a moment to stand and be recognized, and please stand, continue standing. I would also like the remaining faculty to take a moment and stand to be recognized for the hard work and dedication to help all of you meet your goals and your dreams. Thank you. Whatever your journey and path may be, wherever your future takes you, we are happy that you chose Bristol to be a part of that. Now I am pleased to introduce Dr. Cedric Harris, the President of Bristol Community College.
Well, good morning. All right, these folks are getting used to this. You know, I like a hearty good morning. So we're going to try this one more time. All right. Good morning. Good morning. That sounds right. You know, my mother raised 3 boys, and I think she thought one of us would be a minister. And today I get a chance to stand at a podium and share a quick few remarks in welcoming you all to the college, but she would really be proud that her son is standing here to provide information. I will say this, as Dr. Chase shared about the housekeeping minutes, this is probably the safest place to be on campus right now with all these new and current health professionals here. So let's give everybody here a round of applause. As the proud 5th president of Bristol Community College, I'd like to welcome and congratulate all the students and their families for being here today. As Dr. Chase said, this is our 60th anniversary, which we also are celebrating the Health Sciences College. The Diamond anniversary, which was mentioned earlier, both once again for health science and the college. There is no question that our health science programs shine. You all look really well today, and we hope to celebrate you today. Anytime you visit a healthcare provider, you are met by a Bristol grad. Across all of our health science programs, which we will celebrate today, our students have excelled in their final projects, clinical placement, extramurals, and field work. When you apply, students, when you apply for a job, you will be revered. You know why? Because you are a Bristol grad. Our college is known for excelling and preparing healthcare professionals. Bristol graduates are highly skilled and compassionate practitioners. We cannot celebrate this moment without recognizing those who have helped you here, your family members. So students, I want you to take a moment. You don't have to stand, but take a moment to recognize those who have supported you, many who are most likely here today. Just take a minute to give them a round of applause that they supported you through this process. In addition to your family, your faculty members are here to celebrate your success, and they, as well as they are here, they have created a positive impact for you and have made sure that you will touch countless lives in the chosen field that you have moved into. As newly certified health practitioners, your patients are in trusted hands, and those hands belong to Bristol graduates. So in closing, I'd like to say this. As a proud community college graduate myself, it is my honor and my privilege to be here this morning to share this message with you and to say congratulations to not only you, but your support systems. And we look forward to seeing you out in the workforce. We look forward to seeing you in our communities, continuing to help one another and our communities remain and stay strong. Congratulations and thank you.
I would like to introduce Director of Nursing, Jennifer Pimentel, to the podium to introduce the Hawkeye Awards for Clinical Excellence. Jen?
The Hawkeye Award for Clinical Excellence is a recognition that shines a spotlight on health science and nursing students at Bristol Community College who have demonstrated exceptional skill, compassion, and performance within their clinical setting. Those recognized exemplify what it means to lead with knowledge, skill, and heart within the clinical environment. We're going to start off with our clinical laboratory science students. This clinical laboratory science student is recognized in acknowledgement of their outstanding contributions in the field of transfusion medicine. During a complex antibody identification case, this student demonstrated exceptional clinical judgment, attention to detail, and unwavering professionalism. Their vigilance led to the discovery of a procedural discrepancy at the clinical site, an issue they addressed by not staying silent, but by asking thoughtful and appropriate questions. Their initiative prompted a review and immediate correction of the practice, ultimately enhancing patient safety and reinforcing the critical importance of protocol adherence. Their actions exemplify the high standards of excellence we aim to cultivate in our students: proactive, principled, and patient-centered. Congratulations to CLS graduate Angela Reed. Yeah, you can get one. Next, this dental hygiene student has exemplified professionalism throughout their education and clinical training. Known for their strong clinical skills, they consistently demonstrate insight, compassion, and a willingness to support those around them. Whether working with patients or collaborating with peers, this student always goes above and beyond, always ready to lend a hand to contribute to a positive, team-centered environment. Their dedication and integrity set a high standard and leave a lasting impression on all who work with them. Congratulations to dental hygiene graduate Nev Carrera. Next, this medical assisting student from the beginning has embodied the core values of compassion, empathy, and genuine patient connection, always engaging with others warmly and with a smile. Whether in the classroom, the lab, or out in the community, they consistently demonstrate a caring heart and a willingness to help those around them. During clinical placement, their skill and professionalism did not go unnoticed. Providers frequently praised their technical abilities and patient interactions. One physician was so impressed that she even offered to be a practice patient so the student could gain experience with throat swabs. Patients regularly commented on how kind and attentive this student was, often asking to see them again during future visits. It came as no surprise when this student received a job offer just a few weeks into their clinical experience, having made a lasting impression on both staff and patients alike. In a field where male medical assistants are still in the minority, this student has not only found his place, he has excelled. Congratulations to medical assisting graduate Michael Diaz. This nursing student is recognized for their genuine kindness and compassion, consistently creating a welcoming and reassuring environment for patients, peers, and staff alike. They exhibit strong organizational skills, professionalism, and a deep sense of accountability in all aspects of their clinical practice. Notably, they possess a unique ability to connect with others, bringing comfort to even the most disgruntled of patients. As their clinical faculty member shared, having this student in clinical this semester has been a gift, and I am confident they will be a tremendous asset wherever they choose to begin their career as a registered nurse. And we could not agree more. Congratulations to nursing graduate Bakari Jada. Lastly, this occupational therapy assistant student has shown exceptional clinical performance. Always punctual and professional, they communicate clearly, document accurately, and manage their time with impressive efficiency. They've actively collaborated with the care team, exceeded productivity expectations, and demonstrated clinical reasoning and independence at the level of a new practitioner. Their client-centered care, ethical conduct, and quick thinking, especially when responding to a recent medical emergency, have truly stood out. Their faculty seek to thank them for the meaningful impact they've made and recognize their outstanding contributions to patient care. Congratulations to OTA graduate Ava Bernier. I would now like to welcome Dean Dorothy Chase back to the podium.
Thank you, Director Pimentel, for leading our student awards. We're going to begin pinning our students. Each area will have a program faculty share about their program, followed by a student sharing a bit about their experience, and then we'll go through our students for their pinning. We're going to start with our clinical lab science program, followed by our phlebotomy program. I'd like to welcome Dr. Kelly Hiller to the podium. And when you're done with your speech, you can welcome the student. Okay?
How many of you are wondering what clinical laboratory science is? Well, now I get to tell you. So medical laboratory technology, formerly known as clinical laboratory science, this is actually our last graduating class under clinical laboratory science. We are now medical laboratory technology. This is a vital healthcare profession that's dedicated to delivering critical lab information and services that are essential for diagnosis and treatment of disease. Over 70% of medical decisions are made off of laboratory data alone. This underscores the indispensable role that laboratory professionals play in patient care, even though you don't always know that we exist. Through meticulous attention to detail, unwavering commitment, laboratory staff work tirelessly to produce timely and precise results, an endeavor that begins with the expertise of our phlebotomy team. Phlebotomists serve as the front line of laboratory services, skillfully collecting specimens while ensuring patient identity, specimen integrity, and patient safety. Many of you know your phlebotomists very well, especially if you have bad veins. Their work sets the foundation for accurate testing and meaningful diagnostic outcomes. Medical laboratory technologists perform a vast array of laboratory tests, uphold rigorous standards of quality, interpret the significance of their test results, evaluate new methodologies, assess the effectiveness of laboratory practices. Their expertise is critical in transforming raw data into actionable medical insights to help our nursing team take care of the patients. This year's graduating class holds a special place in our hearts, and we're incredibly proud of their achievements, including our Curriculum Award and scholarship recipients, Lila Berg, Veronica Demora, Michaela Estrella, Marquise Texera, and for Medical Laboratory Technology, and Marie Alvarez Nazario for phlebotomy. It's my pleasure to introduce a few of our exceptional students that will be joining us to speak for clinical laboratory science and phlebotomy, Angela Reed and Marie Alvarez Nazario. Angela will come up now and share her experience and reflect on what receiving her pin means to her.
Hi everyone, my name is Angela and I'm one of the clinical laboratory science students graduating tomorrow. Whoop whoop! Yeah! I remember we started as one of the largest classes ever admitted to the program, and as a testament to the rigor of the program, only 9 of us will receive our pins today and pick out our graduation outfits, assuming you've all procrastinated on that second one as much as I have. At the beginning of last semester, we honestly didn't know much. Like, we didn't know which species of strep causes strep throat, and now we know how to prevent it from going on to cause literal heart damage. We didn't know how to figure out somebody's blood type, and now we've issued blood to real patients who needed it. We didn't know what a myeloblast was, and now we can spot a nucleoli from a mile away to help diagnose acute leukemias. Do you realize how incredible that is? Those are all things that can save someone's life. Don't get me wrong, we didn't learn through osmosis. It was hard. There was doubt and tears, especially during that hematology midterm. We had personal problems come up. We lost loved ones. Some of us gave birth, but we kept pushing. Through a grade of 24, through moving apartments, and through stress that at times had us at each other's throats. But we also managed to have a lot of fun. Bathroom office dates, riding that mechanical bull, or intimate conversations that made Jack one of the girlies. We share a bond that probably no other CLS class has ever shared before. And while you might face moments of imposter syndrome and wonder whether you're cut out for this, just think of all the jargon you can rattle off at the top of a hat. Like, you know how to say eosinophil now. You could probably list 10 different anemias without hesitation. And don't even get me started on all the microbes like Erysipelathrix rhiziopathiae, Malassezia fervor, or Fasciolopsis buski. You're not an imposter. You are qualified. Otherwise, you wouldn't have made it through the program. And from being in class with you all over the last 2 years, I know you're all intelligent, kind, and curious individuals who will be an asset wherever you go. So whether your next step is studying for the ASCP exam, jumping straight into a lab role, continuing your education, or using the skills you've learned here in an adjacent or totally different field, I know you'll all be awesome at whatever you do, because you're already awesome, and I'm really proud of you all, and you should be too. Thank you.
I'd like to welcome to the stage again Dr. Hiller and Professor Cinco as we invite the graduates of the CLS program, Clinical Lab Science program, to come to the stage and receive their pins. If you could come up here to the left. Stand. Lila Berg. Jack Craig. Veronica Demora. Sophia Diaz. Chesley Estrella. Michaela Estrella. Elizabeth Fleming. And welcoming back to the stage, Miss Angela Reed. Thank you. As Dr. Hiller indicated in her opening remarks, we are now going to be moving to the phlebotomy student presentation. Student speaker, which is Nay-Marie. Can you please come to the stage?
Welcome. Thank you. I'm nervous. Good morning. It is truly an honor to stand here today. This journey has been one of the most challenging and rewarding experiences of my life. Balancing full-time studies, raising my son alone, and navigating life's responsibilities has not been easy. There were days when the challenges felt overwhelming, but every step forward was driven by my commitment to create a better future. Not just for myself, but for my son, because he deserves the world and everything in it. This program has taught me more than technical skills. It has taught me resilience, determination. I'm not crying. It has taught me, sorry, give me a second. Resilience, determination, and the value of perseverance. I also want to take a moment to recognize our incredible instructor, Professor Hiller, whose passion, dedication, and belief in each of us made all the difference. Her guidance pushed us to be our best, even when we doubted ourselves, and for that, I am very grateful. Thanks to the knowledge and confidence I gained through this program, I am proud to share that I began working as a mobile phlebotomist. It's an amazing feeling to already be living the dream we all worked so hard for. And I am even more excited for what is ahead as I continue toward my goal of entering the nursing program next year. I am so proud of every single one of us. This pin is more than just a symbol of completion. It is a testament to our hard work, our sacrifices, and our shared commitment to making a difference in the lives of others. Thank you to our instructor, Professor Hiller, to our families, to my classmates, and most especially to my son, my biggest inspiration. Congratulations to the class of 2025. This is just the beginning of an incredible journey.
Yeah. Welcoming back to the stage Dr. Hiller, and inviting the phlebotomy celebrants to join us on the stage for your pinning as well. Who's not here? Who's not here? Who's not here?
This one. Oh, wait. Oh, no, I didn't put it up.
Okay. Angela Andrade? I'm sorry, excuse me. Let's start correctly, I apologize. Angelina Andrade. Cecilia Belmiro. Haley Brightman. Lindsay Chubak. Kayla Das Neves. I'm sorry, I must need to correct my pronunciation. Say that again. Kylena Dillard, thank you. Carly Duquesne. Michelle Garland. Lillian Goulard. Jeff.
No. The next one is going to be Stephanie.
Stephanie Rodriguez. Marquise Teixeira. And we're welcoming back to the stage again, Neymarie Alvarez Nazario. And I'd like to invite Sarah. Where are you? What's up? So our next program up that we'll be celebrating right now is our dental hygiene program. And I'd like to welcome to the stage Sarah Williamson, Professor Sarah Williamson.
Thank you, Marie. Hello, everyone. I'm Sarah Wilhelmsen. I'm the chair of the Dental Hygiene Department here at Bristol. So dental hygienists are licensed healthcare professionals who provide preventative, therapeutic, and educational services to patients. For our dental hygiene students, today marks a significant milestone in your professional journey. This year's graduating class has completed rigorous coursework in clinical experiences and demonstrated their commitment through undergraduate research, cultural competency presentations, periodontal research, and community oral health service learning. They've shown competency not just in skill, but through meeting and exceeding our graduation competencies that the program sets forth. Collectively, you've provided many hours of dental hygiene services to members of your community, many of whom are in this room today. That is extraordinary. May the strong ethical foundation that you've built here at Bristol follow you in your practice. May you continually improve your professional knowledge and skills and uphold the highest standards of professionalism and patient care throughout your careers. Today, in recognition of your academic excellence, each sophomore students will receive their dental hygiene pin. You have also been awarded a special honor cord for your service to the community to wear at commencement tomorrow. You've earned this. These graduates truly deserve the honor of wearing their professional pin, which indicates they've graduated from this accredited dental hygiene program. As the dental hygiene chair, it will be my pleasure in a few moments to read all of your names as my colleagues, Dr. Mogauer and Professor Broderick, place your pins upon each of you. So for now, I just want to welcome our class speaker, Kendra Phillip, to the stage. Thank you.
Good morning, faculty, family, friends, and my fellow graduates. Today is a day filled with many emotions, a mixture of pride, relief, and excitement for what's next. When I first started this journey of school, I didn't realize what I was really getting myself into. I thought it was just a regular job cleaning people's teeth. I quickly learned while starting this program that becoming a dental hygienist was so much more. Dental hygienists are researchers, administrators, educators, and most importantly, are advocates for every patient who sits in our chair. As we sit here today, we can look back at many long nights of studying subjects such as pharmacology, anatomy, and practicing our clinical skills. Most importantly, we reflect on the true important qualities we have all gained throughout our time in this program. Some include empathy, compassion, critical thinking, collaboration, and patience. These qualities and the many skills learned have helped us all transform from nervous beginners to confident dental professionals. Today, we are here not just because of our own hard work, but because of the people who believed in us when we were too tired to believe in ourselves. We owe a huge thank you to the incredible instructors who supported us throughout this program. You all stood by us, challenged us, believed in us, and refused to let us settle for anything less than our best. Most importantly, we thank our families and friends. Thank you for your sacrifices, your constant encouragement, your motivation, and for never letting us give up, even when the road felt impossible. Lastly, I personally want to thank my classmates. I will forever be grateful for many friendships that were built on the long days in clinic, shared struggles, words of encouragement, and plenty of constant laughter. These are the friendships that have showed us that we are never alone on this journey. Thank you to everybody for making this journey one of the most meaningful chapters of my life. Today is just the beginning. The skills we have gained, the lessons we've learned, and the friendships we built will stay with us as we move into this next chapter of our lives. Congratulations, class of 2025. Let's go change the world one smile at a time.
I would like to welcome Professor Sarah Williamson back to the stage, and she's going to be reading our dental hygiene students' names. Dr. Mauger and Professor Broderick will be pinning the students. Dental hygiene students, if you'd like to stand and make your way to the stage.
Brittany Baker. Olivia Brewer. Jade Brogan. Nieves Carrera. Samantha Shappett. Christina Conti. Shania Dos Santos. Kendra Phillip. Molly Garrity. Jennifer Silva Gomes. Savannah Lee Helledge. Anna J. Summer O'Donnell. Kiara Pandy. Erica Juliana Paveo. Denisha Marie Perez. Andrea Ribeiro. Nicole Seed. Francisca Inacia Vicente. I'd like to welcome Dr. Chase back to the podium. Thank you.
Our next group of students to be honored are the medical assistant students. I'd like to welcome Dr. Rita Kenahan to the podium to speak about our medical assistant program.
Thank you, Dorothy, and I am so delighted to be here today to congratulate all of you who are being pinned, but especially our medical assisting students. And if you are wondering what is an MA, that's okay. We know RN and CNA and NP, but a medical assistant is a professional who is all over healthcare. Say when you go to your annual appointment with your primary care, it's likely a medical assistant who's made your appointment and helps you check in. When you go to the walk-in or urgent care, who's taking your vital signs, asking those imposing questions, and getting you ready to see the doctor? He or she is likely a medical assistant. And when you have billing questions, it's a medical assistant who can help you. These are professionals all over healthcare, and we are so delighted with the program that they've been through. Our medical assistants learn administrative skills and clinical skills. So they learn medical terminology, patient record keeping, how to do billing and coding. They also learn so many clinical skills, vital sign taking, EKG, giving injections and medications, drawing blood, which is really the fun part. Come on, admit it. We can do all kinds of procedures. We even have a pediatric day that is kind of fun. Yeah. So it is delightful to be able to congratulate these folks. And if you've ever thought about a career in healthcare, think about medical assisting. You'll learn so much. It's a wonderful program. But there are a couple of skills that our students have that we couldn't really teach them, but they came to us with it in droves. They are compassionate people who care about their patients. They know how to educate and tell people in a meaningful way how to take care of themselves. And they have empathy, and they really worked on their communication skills, and they're not even scared anymore. So I really want to congratulate you again, and thank you so much for your hard work and dedication. So proud of you. I would like to invite Teresa Phillip to the podium, please. She'd like to give you her side of it.
Good morning. My name is Teresa Phillip, and I am a little bit nervous. I usually talk a lot, but I'm nervous right now. So no matter where you are in life or what stage of life you are in, you are never too young or too old to learn or follow a dream. Learning to evolve into the person you were meant to be, making that promise to yourself, setting a goal, and be able to understand the values of growth and development. Allowing yourself to make that sacrifice, that choice, that commitment. Strive for a purpose. Be that purpose. What does penning mean to me? Accomplishment. We accomplished another goal in life. Thank you.
I would like to welcome Dr. Kenahan back to read the names of our medical assistant students, and Professor Tebow will be pinning the students. Medical assistant students, if you'd like to come forward so that you can be pinned.
Thanks, Dorothy. I'd like to welcome Michael Diaz. Ni Nguyen. Teresa Phillip again. Last, certainly not least, Avery Smith.
Our next group of students are our EKG students, and I'd like to welcome Angela back to the stage.
The graduating EKG students have much to be proud of. The skills they have learned include taking vital signs such as checking pulses and blood pressures, performing accurate EKGs, placing 24-hour cardiac monitors, and setting up stress tests. They have the knowledge and understanding of how to interpret the EKG tracings and how to identify both normal and abnormal rhythms. These graduates are now ready to put their skills to good use and become members of our healthcare community. It would not surprise me to see any of these graduates continuing on to becoming medical assistants, EMT, or nurses. This is just the beginning for them. Congratulations. I would now like to welcome EKG student Pam Nickerson.
I'm honored to speak, so thank you to everyone. Thank you, Angela. 3 years ago, I was admittedly attending a pity party for one. It was attended by me. And for those of you with young children, I want to tell you that empty nest syndrome is very real, and reflectively, it happens overnight. My grown children are now engaged in their own schooling, their careers, their hobbies, their travel, and I am very proud of them. I am aware, and I was already aware, of all that BCC offers older learners, but what could accommodate my schedule? What skill would have the flexibility to supplement my income? And how could I help others? I have always been interested in anatomy and medicine, but my career went in another direction. At open enrollment, I was ecstatic to learn that the electrocardiography certification program would accept many of my credits. For me, those date back to 1989, the year I graduated SMU, now UMass Dartmouth. I had never taken an online class. I had never used an electronic textbook. But with the encouragement of my great family and great friends, I enrolled at BCC. For many of my classmates, heart health is very personal to our families, and we shared those stories with one another while we were learning. In 2006, my active, vibrant mother, Wilhelmina, suffered a MI. For several days, she'd been feeling nauseous, dizzy, feverish, discomfort in her left side. She theorized she was exhausted after driving 7 hours to Fall River from down East Maine, where she probably drank too much beer and ate too much lobster. And she figured she was overheated, dehydrated, maybe pulled a muscle, picking up her grandchildren who were excited to see their Nana. It was the mailman, yes, the mailman, who recognized the symptoms, and he called 911. My mom required 3 stents in the left anterior artery. 2 hours after the procedure at Charlton Memorial Hospital, she was applying lipstick, she was asking about her grandchildren, and very concerned if we had yet told my dad, who was still in Maine. Just 18 months later, in 2008, my dad was felled by a STEMI, the Widowmaker. He collapsed in the living room during a snowstorm on New Year's Eve, and my mom was by his side. They had been married 43 years. We EKG students now understand the unique symptoms of male and female MI, and our mission is to convey that life-saving information. Our advisor, Angela Tebow, is greatly helpful navigating online learning, and she makes me laugh. She makes our meetings go a little too long. Thank you also, Lucy and Ron, our instructors. Our class is diverse with learners from Haiti, Egypt, and Cape Verde. We've helped one another with inverted U waves, avoiding the artifacts, and finding that elusive sweet spot for BP. My intention now is to pass the national exam, apply for job shadowing, and consider classes in medical assisting. And over the summer, spend time with my children. Thank you all, I'm honored.
I'd like to welcome Professor Tebow back to the stage to read names, and Lucy will be pinning the students. EKG students, if you'd like to stand up and come to the podium or come to the stage.
Give them a minute to get there. Caroline Abdelmak, Camilla Afonso, Ashley Amaral, Courtney Marie Barboza, Gerald Bates, Hannah Calise, Rose Defendra, Jessica Dias, Nerland Edward, Lindsay Gabriel, Jada Mui, Pamela Nickerson, Brittany Marie Oliver, Orlando Alves, Pyers, Courtney Senna, Miranda Stefanik, Elizabeth Tavares, Monique Texera, Jan Thomas, Jennifer Travis, Heather Lynn Trotsky, Amanda Vasconcelos, and Lily Wynn. And back to Dorothy Chase.
Our next population of students that we pinned include our nursing students. I'd like to introduce Director Pimentel, who will be doing our reading.
Hello. So at some point in your life, everyone in this room has been impacted by a nurse. Whether it was during a moment of joy, uncertainty, fear, or loss, nurses are there. They are the steady hands and compassionate hearts who guide us through some of life's most vulnerable moments. Nursing is far more than a job. It is a calling rooted in service, skill, and deep humanity. Nurses are highly trained professionals who blend science and compassion in every task that they perform. You may only see that they monitor vital signs, give some medications, they respond quickly in emergencies, but they also listen deeply. They comfort the fearful, and they advocate fiercely for the best in patient care. Nurses are also educators, teaching patients and families how to manage illness and promote health. They are coordinators, ensuring care is seamless across various care teams and settings. They are leaders on the front lines of change, pushing for better outcomes, equity, and safety for all. To become a nurse is to choose a life of presence. It is to show up every day with empathy, integrity, and the belief that every person deserves dignity, respect, and care, no matter the circumstance. To elaborate on the student perspective of the journey to nursing and what it means to them, I would like to invite one of our Savannah Pachicos, we do have two, up to the podium. Hi, everyone. My name's one of the Savannahs. It is with deep gratitude and immense pride that I stand before you today at this special moment, our pinning ceremony. To our faculty and mentors, thank you. You guided us through the most intense and transformative chapters of our lives. You didn't just teach us nursing, you modeled what it means to care, to advocate, and to remind us that growth happens even when we're uncomfortable. You are our mentors, our cheerleaders, and sometimes therapists. To our families, friends, and loved ones, thank you for standing by us. Thank you for the late-night pep talks, the patience during our emotional roller coasters, and the unconditional love that helped us keep going. You cheered us on through sleepless nights, stressed-out study sessions, and long clinical hours. Your encouragement helped us become who we are today. This pin belongs to you, too. To my classmates, wow, we did it. Let's be real, nursing school was not easy. We came in anxious and overwhelmed, and we're walking out as nurses. We battled long nights of studying, early morning exams, and that ever-elusive balance between school, work, and life. And we didn't just learn procedures, we learned empathy. We learned what it means to listen when someone is scared, to comfort when there's pain, and to be a steady hand in moments of chaos. We've been through so much together, and yes, those unforgettable days in the simulation lab. I remember those times walking into that simulation room, and I swear everything left my head. Oh boy, the anxiety that room had given me. I cannot put myself in everyone's shoes, but I can imagine that everyone had a different trip and everyone's road looked a little different. Some people's roads were a little more curvy than others, and some people may have had a few more bumps than the rest. But no matter how your road was paved, you made it to this destination, and for that, I want to say congratulations. Some of us lost loved ones during these years, others battled illnesses, financial hardship, or personal struggles, all while pushing forward. Each of you carries a story of perseverance, and that story matters. That story will make you the nurse someone will never forget. The celebration today is not just an event, but it's a reminder of who we are and what we have chosen to dedicate our lives to. This is a promise to carry forward everything we have learned from those 10-pound textbooks and each other, whether we end up in the ER, a pediatric unit, long-term care, mental health, or anywhere else. Never forget the power of kindness. Never forget why you started. Being a nurse isn't just a job, it's a calling. It's a promise to show up with empathy, to keep learning, and to be a light in someone else's hardest moment. The world needs nurses like never before, and I truly believe the world will be better because of each one of you. We're going to add value to this community. We're going to help so many people and save many lives. So here's to new beginnings, to the moments that shaped us and the ones that await us. Here's to the sim labs, the clinical, the breakdowns, and the breakthroughs. Congratulations, class of 2025, we made it.
Thank you, Savannah. I would like to ask the nursing class of 2025 to start making your way towards the stage, please. I'm not very tall. Why don't we make this a little bit easier? Why don't we have one row come at a time? The rest of you can sit, celebrate, and then adjust accordingly, right? Okay. Jasmine Adolfo. Glyza Aguiar. Taisha Alexander. Patrick Alves. Chloe Amaral. Amanda Angel. Brittany Arujo. Noah Avalor Forts. Brianna Baker. Alexia Barber. Samantha Belmore. Faith Berry. Kaylee Bachner. Melanie Borges. Stacy Botello. Travis Botello. Madison Braga. Angela Briggs. Kendra Kamara. Diana Campbell. Lindsay Carrero. Godwin Chukwu. April Lynn Cordero. Tara Cordero. Courtney Cusson. Aveen Michaela DePina. Autumn DeSaw. Dawn Destin. Nicholas Dos Anjos. Haley Drago. Rachel Dupuy. Kendra Ferreira. Lauren Fichtenmeyer. Megan Field. Hannah Guimont. Jordan Hoeg Chick. Rachel Howard. Danielle Jackson. Yeah. Bakari Jata. Asia Jenkins. Nora Johnson. Taylor Johnson. Louisa George. Marissa LaChapelle. Emily Lally. Daisha Lee. Cassandra Leone. Hayden Levesque. Jeanette Losell. Katie Lewis. Luke Lyons. Alexis McCabe. Chevonne McTavish. Jenna Mitson. Hope Murphy. Jordan Pacheco. Savannah Pacheco. Savannah Elizabeth Pacheco. Alicia Palais. Hannah Pax. Haley Pereira. Crystal Pereira. Alyssa Perez. Ava Perry. Kelly Petipus. Jessica Prophet. Cassidy Raposo. Christina Reynolds. Isis Rock. Karen Santos. Paul Saucier. Amy Shurins. We're getting there, folks. Kaylee Sheldon. Aurea Sousa. Mariana Sousa. Zoe Sweeney. Celine Sylvains. Frida Sylvia. Kaylee Cipher. Joanne Taylor. Elise Beloy. Pause for one moment.
Carla, Estella, they added it in here. You don't have it.
Apologize for that. You're coming. It's just a matter of order. So how about we now welcome Jessica Warwick. Jocelyn Wozni. And last but certainly not least, Carla Estella. Thank you very much to the nursing class of 2025. Middle welcome.
All right, nursing, settle down. You're not the most important in the room, even if you think you are. You've all heard I'm a nurse, but I'm not going to let you take over. All right, I'd like to welcome Dr. Connie Messier from our Occupational Therapy program to come forward.
Hello, everyone, and thank you for attending today. Bristol's Occupational Therapy Assistant Program advances the mission of the college by providing an accessible, innovative, and inclusive education that prepares the student to enter the workforce as an entry-level practitioner. Occupational therapy enables people of all ages to participate in daily living activities. Occupational therapy practitioners focus on what's important to the client and use everyday life activities, occupations, to promote health and well-being. OTAs work with individuals across the lifespan in a variety of healthcare and community settings. Bristol Community College's Occupational Therapy Assistant Program has prepared these students to support their community and fulfill their dream to become a professional, competent, and respected occupational therapy assistant. I speak to the regard of this program in the community as an alum. Many of our faculty are alum, and we want to welcome you to the wonderful profession of occupational therapy. Right now, I would like to invite Cole Roundbuehler, our pinning speech OTA representative, to the podium.
Oh, perfect. Hello, hello. Thank you guys for taking some time to listen to my speech. Hello, Bristol Community College students, faculty, and guests. Congratulations to each and every one of you on your hard work and success this year. We've made it to the finish line. Today isn't just a celebration of academic achievement, it's a recognition of how far we've come, both individually and together. From day one, the Occupational Therapy Assistant Program at BCC has shaped not just what we know, but who I am. It has changed the way I see the world and myself. I've learned that everyday things we do, whether they seem significant or small, have the power to shape our lives. This program has taught me so much about simple things, managing your day with intention, exercising after a long day of studying. It can make self-care better and your overall performance better. It's what we call occupational balance. And finding that balance is at the heart of what we do as occupational therapy practitioners. For me, that balance has become personal. This profession has brought purpose into my life, helping others regain control, find joy, and rediscover what matters most to them through meaningful activity. That is the kind of work that leaves a lasting mark, and that meaning I know resonates with all of us in this room. The pin we received today is more than just a symbol. It represents the compassion we built, the knowledge we've earned, and lives we're preparing to alter. It connects us as classmates as future health professionals, and as members of a community that believes in dignity, equity, and healing. None of this would have been possible without the people we have walked alongside us. Thank you to our faculty in Fall River and New Bedford for putting students first every day. Thank you to my peers for the study sessions, the shared struggles, and the inspiration. You've helped me grow, not just as a student, but as a person. To our fieldwork educators, thank you for bringing our learning to life. And to the faculty who led us with patience and passion, Professor Messier, Professor Pimentel, Professor DuPont, Professor Cousins, Dean Chase, who stepped in when we needed her most, and OTA, Ms. Woodcock. Thank you for modeling what it truly means to be a dedicated, compassionate professional. To anyone considering this path, if you have a passion for helping others, a drive to create change, and a belief in the power of human potential, this field is for you. Occupational therapy stands for inclusion, resilience, and the right to live a meaningful life. As we move forward, I hope each of us carries that meaning into our future work. In the words of novelist Pavase, we do not remember days, we remember moments. And I hope that this moment will be one you carry with you always. Congratulations, class of 2025, and here's to many more moments ahead.
I would like to welcome Professor Karen Pimentel forward to read the names of our students that are being pinned. Dr. Messier will be pinning the students. Oh, and Professor Cousins will be pinning as well.
Thank you. Okay. The OTA students want to come up to the stage, please. Madison Bedard. Ava Bernier. Alexandra Creechin. Joshua Clark. Sinead Conroy. Aubrey Davey. Leslie Figueroa. Allison Rishu. Nikita Martins. Veronica Normandin. Brooke Montero. Daniel Robillard. Nicole Roundbeeler. Taylor Swash. Jamale Vargas. Mackenzie Xavier. Now I'd like to welcome Dean Chase back to the podium.
I want to take a minute to thank the OTA students and give them a round of applause. They have been through a roller coaster this year. They had to put up with me a couple weeks of teaching, and they persevered and they did an awesome job, and I just am so proud of every one of them. So I'd like to take a minute to talk about ethics. In all medical professions, we make a solemn commitment to uphold the highest ethical standards. Many are familiar with the Hippocratic Oath. It's one of the oldest and most enduring expressions of medical ethics in the Western world. Originating from the ancient Greek medical texts, the original version includes a pledge sworn to several healing gods: Apollo, the Greek of healing and medicine; his son, the god of medical art and healing; his daughters, Hygienia, which comes from, of course, the goddess of health and cleanliness; Panacea, the goddess of universal remedy. These deities or gods represented the sacred responsibility of caring for the sick and the importance of ethical conduct in the healing professions. That's where that Hippocratic Oath came from, and we usually hear about that in the medical profession. Though the wording of these different oaths have evolved over time, the core principles of compassion, integrity, and respect for life remain at the heart of our work. Every single one of our works, regardless of what profession we've chosen. Today, we're going to continue that tradition, and I invite all of our health sciences and nursing students who will be graduating tomorrow to please rise, turn to the back page of your program, and join in reciting the professional promise and ethic pledge together. I'd like the faculty as well to do the same. So if you could all stand. You don't have programs, really?
Repeat after.
So instead, you're going to repeat after me. Thank you. All right, are you ready? Do you think you can repeat after me? I mean, you're all graduating tomorrow, I hope so. All right. In full knowledge of the obligations I am undertaking, I promise to care for those I am responsible for. With all the skills and understanding I possess. Without regard to race, creed, color, politics or social status, sparing no effort to conserve life, to alleviate suffering and to promote health. I will respect at all times the dignity and religious beliefs of the patients under my care. Holding in confidence all personal information entrusted to me, and refraining from any action that might endanger life or health. I will keep my professional knowledge and skill at the highest level and give loyal support and cooperation to all members of the health team. I will do my utmost to honor the code of ethics and uphold the integrity of my profession. Woo, you guys did awesome. All right, you can all be seated. I'm going to welcome Marie Kaczmarski to the podium for closing remarks.
That's me. Jen. Well, we are towards the end here, a few more minutes. Thank you so much for all of our little ones' patience, because I know that you guys are here to celebrate your loved ones, and thank you so much for that. Well, what a privilege it really is to stand here before you today, to be able to offer these closing remarks on this truly special occasion. The pinning ceremony for the nursing and health science graduates of Bristol Community College. Before we close today, I'd like to take a moment to warmly welcome back to the stage our new president, Dr. Sedgwick Harris, and welcome into Bristol Community College. We are honored to have you with us today and excited to have you here for today and for the future, and your first pinning ceremony with us as the health science and nursing academic area and with our graduates. So with a small token of our appreciation, a gift of welcome to the college and a gift of welcome to what the future may bring, and thank you for that.
Thank you.
Today is a celebration of achievement. It really is, a perseverance and of your purpose. To our graduates today, this marks the culmination of dedication, not just in the program, but all of the time that you spent thinking about what you wanted to do, taking courses to get into the program, and everything that you, your family, your loved ones have worked hard for you to be here today to celebrate. You have not only mastered material, but you've grown into the healthcare professionals that our communities need. The pin you received today is more than a symbol, it's a promise to serve with skill and with heart, to uphold the values of the profession and never stop learning or growing. It represents your readiness to step into a world that needs you. Your competence, it needs your compassion, and it needs your commitment. And I'm very excited to look upon your faces knowing that each and every one of you have that and are ready to give that to our community. So thank you for being here today as that. And as you move forward, know this: you carry not just your own dreams, but the hopes of the patients you will care for, and for the strength of the Bristol community that is behind you. Here at Bristol Community College, we take great pride in being much more than an institution, but a community that many of you come back to. Because the very neighborhoods that you drive through to get here, and the very neighborhoods and communities of facilities and the people that you will be caring for are those that are around you here today. No one accomplishes such a meaningful thing alone. I want to take a moment also to recognize again the faculty of Bristol Community College, many of whom stand behind me on the stage and also in the audience, who have come here to see you. These are educators and mentors who have stood by your side every step of the way. They challenged you. They made you think critically. They asked you to think beyond what felt comfortable and to push you to areas that did not feel comfortable. Even when the journey got tough, they guided you toward the highest standards of care. They have not given just their time and expertise, but their hearts, their encouragement. And I would like to take a moment for you to be able to thank your Bristol faculty, as the impact they've had cannot be overstated. Your commitment to excellence, equity, and empathy has shaped not only these students before you, and your students before you that way too, both ways, but also the future of the healthcare in our region. So students, let's please give our faculty a round of applause for doing this for us. Thank you. Graduates, as you leave this ceremony today, I encourage you to carry forward the lessons that you've learned here at Bristol. Let your skills be sharp, your hearts be open, and your voices be strong and loud when appropriate. You are joining a proud tradition of Bristol graduates who serve with the distinction and integrity, making real and lasting differences in the lives of others. So today we celebrate you not just for completing a program, but for stepping into a calling. And I can say with full confidence, this community that you will go on to serve is going to be better because of you. Congratulations to the Bristol Community Nursing and Health Science class of 2025. We are so very proud of you. We are going to have a processional now, and ending our event as our graduates will stand and recess out of the auditorium in the order that you came in. So graduates, please rise. You will be followed by your faculty and professional staff on stage out. Thank you so very much. There is a Okay, apparently you need to go that way to get Cecilia. Thank you so much, class of 2025.